insurance bill. It now just requires the President's signature to become law. Let's explore the road ahead for the plan to create universal healthcare in South Africa with the Deputy Director General in the Department of Health, Dr. Nicholas Crisp. Dr. Crisp, thank you so much for joining us. This is an important milestone. The President now will sign this bill into law. I would imagine that is a fairly seamless process. What is the very next thing that has to happen once the President is signed?
Yeah, thanks very much, Sally, and good evening to the viewers. There's still a very long road to go. Of course, these things are never straightforward. So what has happened is that an almost 5-year process in Parliament, interrupted by COVID, has come to an end. And now we begin the process of formulating what was a bill into an act. The first step is for the NCOP to send it to the President. The President may or may not assent to the legislation, and there are various reasons why he may not do that. He may want amendments or even send it back to Parliament. But assuming that it is assented to, the next step is to promulgate the clauses, which will now become sections of an act, into law. And in Section 59 of the bill, the last section, says that the President may affix different dates for different clauses. And the reason that's very important for us now is that, of course, the NHI doesn't exist, doesn't have a board, it's not an agency of the government. It's an idea still until it is implemented. So the very first thing we need to do is to, following the provisions of the transitional provisions in Section 57, is to get a board appointed, get the board committees in place, get the other advisory committees in place. And that's quite a long process. If one reads from about Section 12 to 30, one will know that there needs to be ad hoc committees to interview candidates. Candidates must